Good morning, Dr. Pramon.
Good morning, Dr. Is that Dr. Thank you.
Yeah, it's already 9. So our dean will be late. So she said to me that she will greet you after she attend a meeting in another Zoom room. So we can start at 9.
Mhm.
Okay. Maybe I can introduce you first to our department member. We have Mr. Dian Santo. Mas Dian, maybe you can say hello.
Selamat pagi.
Oh, that's great. Selamat pagi. Okay.
Hmm.
We also have, maybe he's away right now. Bu Erna, are you there? Mm, no one there. Where are they? They just chat me. We have already 148 students.
So for 1.5 hours, so uh, the Q&A session will be 15 minutes, right? So I can allocate the time from the presentation 9 to 10:15. Would that be okay?
Okay, so your presentation will take an hour or an hour and a half.
I think it depends, but I think some of the student might have the questions, so I
Sure.
might allocate some of the time to let them ask the questions.
So they can ask you in the during your presentation, or we should collect the question after your presentation.
Maybe after the presentation.
Sure. Okay. Okay, I think we can start now. While we also wait for our dean to join. She already said to me that she has another Zoom room and she will visit our Zoom room after she has meeting. Well, we can start it now.
Yes.
Yeah, sure. Thank you. Well, welcome everyone. Good morning. It's very glad to have Dr. Pramon as our main speaker today, and he will deliver his material on the COVID-19 and strategies to contain it in Thailand. We know that Thailand is one of country that successfully combat this COVID-19 crisis. I can share you his short biography. Let me share it first. Let me introduce to Dr. Pramon. His name is Dr. Pramon Fiwatana Kulfanit. Presently, he is a lecturer at the College of Public Health Science at Chulalongkorn University, and he graduated from Chulalongkorn University for his doctoral degree, and then he also graduated from University of Colorado at Denver, USA for his master's, and then he also graduated from Chulalongkorn University with bachelor degree of pharmacy. His background: he expert in statistic, pharmaceutical cares, and wait a minute again. And the patient support group. Currently, he is a lecturer at the College of Public Health Science, Chulalongkorn University, and he is one of the executive committee members of Parkinson Patient Support Group at King Chulalongkorn Memorial Hospital and Qigong Association at Olympic. I think if I read it all now, it will take more minute to read all of this. So we can start our uh, main session today.
Sure. Uh,
Yeah. Okay.
thank you.
Time is yours.
Mhm.
Yeah.
Thank you so much for the introduction.
Yeah.
And let me check screen first.
Yeah. We stop it.
So I would first of all I would like to thank you for Dr. Santi to invite me uh, for this for being a speaker for today on the topic of the COVID-19 and strategies to contain it in Thailand. So uh, actually at the beginning of this year, I got a chance to go to uh, here. And also, I so happy to learn about the cultures and also exchange the knowledge with some of the faculty members at the University of the Muhammad Sula Qatar as well. I was so happy and hope to go back to Indonesia if I got a chance if COVID-19 is over. And Sinak Pagi and Abaka, let me say, I'm not sure I say correctly or not. Abakaba, right? One, Abakaba. And for the outlines for today, we're going to talk about the COVID-19. Maybe we can talk at the beginning about the background of the COVID-19 together first, and then I will jump into the overall situation about the COVID-19 in Thailand, and then I will talk into two parts. The first part is about the university level to fight against COVID-19. The other parts I will talk about the nation, I mean Thailand, how they fight against COVID-19 as well. So you can learn from the university level what we can do for the COVID-19 situation like this, and also for the nation level, what should we do? But to keep in mind that right now the situation of the COVID-19 Thailand maybe is the good example, but it's not maybe the best practice, but you also can learn and also apply some of the strategies and match with your cultures and different situation as well. There's someone raise the hand. Hello. Is there someone raise the hand or have the question? Sorry, I will go on.
Yeah, you can go on.
Okay, let's start with the COVID-19 background. As you know that COVID-19 is a coronavirus disease and is found in the 2019 and the place that we found in the Wuhan city, China. And coronavirus or COVID-19 is the latest member of the coronavirus family. And as you know that we also found some of the viruses in the corona family already. First one in the table, you can see Spanish flu, Asian flu, Hong Kong flu, SARS, swine flu, Middle East respiratory syndrome, and COVID-19 is the latest one. And it's really impact a lot of people around the world. That's why we need to fight together to figure out the solution for this one. Speaking of the median incubation periods of the COVID-19 is about 5.1 days, and you can see the developed symptoms approximately about 11.5 days. That's why when you have like a quarantine, you are supposed to have the period approximately about the 14 days. If that people who's exposed to the COVID-19, maybe they need to quarantine about 14 days. And the symptom of the COVID-19 is like a common flu, also have the fever, cough, shortness of breath, fatigue, headache. But anyway, the severity of the illness depends on the characteristic of the patient as well. As you know that for the elderly, they tend to have severe symptoms compared to the young people. And also for the patients with the comorbidities like diabetes or the hypertension, they tend to have the severe symptom as well. But the scary thing is about the people who have a symptomatic infection. This is really important. Sometimes they thought that they have no symptom at all. They also still could go outside and spread the virus to other people as well. This is also really need to be concerned as well. Speaking of the transmission of the COVID-19 can be direct contact and indirect contact. Direct contact, you can see that mouth, nose, and eyes can be like a channel for the COVID-19 to go inside the body. So it's really important not to have like a contaminated some of the fingers touch your nose or your eyes, your mouth. You need to have the hand hygiene first. And also the indirect contact. The virus can transmit into the body to the droplet and transmission as well. So if you need to go into the crowded, you need to be careful and also for the poor ventilation environment as well. And for the test of the COVID-19, we have three kinds of tests. The first one is the polymerase chain reaction test, the PCR. This is the standard one. And the second one is the antigen test, and the last one is an antibody test. Even though the antigen test and antibody can give the result faster, but PCR test is required for the standard test to confirm for the COVID-19 diagnosis. And the standard guideline to prevent the COVID-19, as some of you may know already, the physical distancing, also wearing the face mask, and also the hand hygiene. This is that help a lot to prevent the COVID-19 infection. Then we jump into the overall situation of the COVID-19 in Thailand. Actually, this morning I also checked the cases, or the total cases is around 3,699. And also, most of the cases come from the state quarantine. It means that from the passengers who just came back from other countries. And this is a graph of the new cases of the COVID-19 rate in Thailand that you can see. We found the first case in January, and then in March and April, the situation that the COVID-19 cases rising up a lot. And then we try to fight together, manage and handle the situation together. And then after around May until now, the new cases of the COVID-19 is decreased, and you can see the graph flat down. In January, when we found out the first case in Thailand, Thailand launched the organization called Emergency Operations Center, EOC. And then later on, we also launched the Center for the COVID-19 Situation Administration, called as the CCSA, in March. This one I will talk into details a little bit for the last part of the presentation, why we need to launch CCSA, because we have EOC already. But there may be some of the reasons why they launched the CCSA. I will tell you later on. Now, we jump into the part of the university, how the university can fight the COVID-19. In this example, I will show about the Chulalongkorn University, how they took the action to fight against COVID-19. Actually, when during the January, when I worked, I got like an announcement from the university that all the lecturers and everyone need to switch from the regular classroom into the online classroom, and the university will support kind of the IT technology to support when we teach in the class, use the online to teach the student. As at that time, I think the key points, the president of the university and the management team, they try to have the clear communication to all the staff or the student as well, how they handle the situation. And I'm very thankful for the management team as well, that they prepare all the staff as students at the beginning and communicate clearly what we need to prepare. And after the situation of the COVID-19 is getting better, the management team also allow the staff to come to the campus as well. And we also provide all the guidelines, all the standard practice. And some of you can see the picture that I show you on the slide. Also the mask and also the alcohol and mask spray and the guideline for us, for the staff and also the student as well, how to uh, how to practice when they come to the university. At the same time, we also have the health service center as well to screen out and allow for the staff or the student who are risky to exposed to the COVID-19 and come to this center and check up for the COVID-19. But it doesn't mean that everyone need to go check up. What I'm trying to say that in the center, they also have the screening process as well. That how risky you to the COVID-19. And if you have the high risk, they also have maybe blood test or PCR test for you to check and confirm about the COVID-19 diagnosis. But if you have a low risk, maybe the quarantine about 14 days might be better. And at the same time as the university, we also concerned about the student as the first priority. During this tough time, some of the family members, like the parents of the student, they might be out of the job, cannot make money, cannot earn any incomes. So that's why the university also have the financial aids. We also reduce the tuition fee and also help the student reduce. If the student stay in the dormitory, we also reduce the dormitory fee as well. At the same time, as you know that we switched into the online course, and the online course student required to have like an internet connection and also need to have like a laptop or notebook. So that's why the university also have the policy to give out the SIM cards for them, for the student to have the internet connection, and also have the lending notebook or laptop as well for the student who qualify to borrow the notebook from the university. So we try to help all the students to go on the academic, even though we face the tough situation right now. And speaking of the innovation that we have in the university, Chulalongkorn University, we also have the mission during the COVID-19 that we will try to develop the research and innovation to fight against COVID-19. At the same time, we have so many schools inside the university, medical school, pharmacy school, faculty of art, a lot of departments, but we try to work together and come up with the research and innovation together inside the university. And also we focus to support for the medical team because we know that they are really important to be like a front line to take care of the COVID-19 patients, and they got a chance to get infected as well. So we need to come up with something to support or innovation to support the healthcare professionals. And one important thing is that we try to transform the research study into the innovation as well, and also contribute to the society. This is a examples innovation that we have right now in Chulalongkorn University. And I think a lot of people really interested in the COVID-19 robot that we have. So in this presentation, I will show the way of the robot work against the COVID-19, and also talk about other innovation as well that we have. For the CU Lobo COVID, or the robot, is developed by the Faculty of Engineering, try to support the medical teams and also reduce the workload of the medical staff as well. And you can see that we have the three types of the robot. The first one is a Pinto robot. The second one is the mirror robot. And the last one is a ninja robot. Speaking of the first robot, that is a Pinto robot. Pinto in Thai is mean like the food container. So that's why the purpose of the Pinto robot is to deliver the food or carry the food and medicine to the patients. You can see the picture of the Pinto robot. And we also have the Miller robot. Normally the Miller robot is equipped in the Pinto robot as well, that you can see this. But the purpose of the Miller robot is work as a telemedicine system, try to facilitate the communication between doctors and patients, and keeps a distance from the patient to the doctor as well, and reduce the risk for the infection between doctors and patients. And for the ninja robots, also have the same purpose as the Miller robot as well, that they use the telemedicine system try to facilitate the communication between the doctors and patients. And also inside the ninja robots, they also have some of the equipment for the patient to check their blood pressure, pulse, and temperature by themselves as well, and report back to the doctors through the ninja robots. So this is a picture of the Pinto robot and Miller robot. And this one I will show a little bit how the doctors control the Pinto and Miller robot and take care of the patient. You can see this is a doctors, and this is a Pinto robot and Miller robot. So the doctor control the robot, and then on the screen of the Miller robot, we have the pictures of the doctor, and the doctor also asks some of the questions to check up for the patients, and patient also can respond and communicate to the Miller robot with the doctor as well. So this one reduces the risk for the doctors to get infected for the COVID-19. And you can see the screen, right? And the doctor also can communicate through these, and also can see the condition of the patient as well, and no need to have like a direct contact to the patients. And right now, we also send the Pinto and Milo robots, about 500 pieces to hospitals all over Thailand. Then we speak a little bit about the Ninja robot. Actually, Ninja robot is also help, not just only for the COVID-19 patient, it's also help for the stroke patient as well, for the rehabilitation as well. Because in this Ninja robot, it will stay at the patient's place, and also the caregivers maybe need to be in the training. Also, the some of the patient as well who have ability to function, they also need to be trained as well how to use this kind of the robot. Because in Ninja robot, they have many features for the patient and caregivers to use to check all the blood pressure, temperature, and also the condition of the patient. And all of this information we send back to the hospital, and the doctors will check that again. And this robot also used as well more than 10 hospitals right now in Thailand. And they also develop more and more function in the digital robot to use and uh, and help other kinds or other types of the patient as well. For another innovation that we have in the university, we also have the strip test. This is the test that we use to screen for the COVID-19. This is developed by the faculty of pharmaceutical science. It uses the concept to extract the protein from plant, and also coding into the strip test. And the patient need to draw the blood a little bit and check, because this one is the test for the antibody, and the test will take just only 3 to 5 minutes and will show the result. But anyway, if the result is positive, still need to be confirmed with the PCR as well for the COVID-19 diagnosis. So this strip test is used for the screening process only. And the third innovation is the face shield from the engineering school. For this, face shield is made of some of the special material from the polypropylene thermoplastic elastomer. So that's why this face shield is quite comfort, and also have the quality to anti as well, and protect the face of the people who are risky to get the infected for the COVID-19. The third innovation is the spray for the fabric mask. This one will increase the protection efficiency about 83%. The spray is like a polymer. When you spray into the fabric mask, it will change the structure of the fabric mask to be narrowed down the hole inside the structure of the fabric mask. So that's why it's increased the protection of the fabric mask, but it cannot be used for the medical mask or the surgery mask. This one is used just only for the fabric mask only. And then another innovation is about the negative pressure cabinets for the specimen collection. So in this innovation, you can see it's like the chamber or the cabinets, right? And this is a doctor, this is a patient. So when the doctors would like to correct the respiratory specimens, uh, the doctors no need to have the direct contact. The doctors use this kind of chamber to collect the respiratory secretions from the patient. And also we also have the system to clean the cabinet as well. So they also use for another patient when they want to collect another specimen. And this one is a VQ20 spray dispenser. And this one used to clean the room and also medical equipment. And they use the hydrogen peroxide to clean all the room and medical equipment. It can disinfect for the bacteria and virus in the air and on the surfaces as well. This one developed by the Faculty of Science. The seventh innovation we call lung care application. This innovation is an application developed by the Faculty of Science and Faculty of Medicine to check the performance of the lung. But keep in mind that this application we didn't use to diagnose for the COVID-19. It just shows just only your lung performance only. If your lung performance show the yellow or red color, maybe you need to go to see the doctors and get checked up. And you can see that after we load the application, you need to blow into the actually the cell phone. They also have some kind of the holes that you can blow. If you change into the wave sound, that's how the lung care application works. And then after that, they will show the color or the test result that how well of your lung perform. And the last innovation is the wheeling application. I can say that wheeling application use the concept of sharing together, because in this application they try to match between the recipients and donors. Let me give you an example, like if you want to donate the mask to the people, you can go on to this application and put some of your information and show the mask that you and amount of mask that you want to donate. At the same time, the recipient who really want to have the mask, face mask, they also post some of the information as well, that they really want the face mask and try to find the face mask from someone. So in this application, we match between the donors and also the recipients to talk together and help each other. So that's why they call the wheeling application. And at the same time, for the vaccination development, for the Chulalongkorn University, they also have the two pipelines to develop the vaccine as well. Uh, the first one developed by the Faculty of Medicine, and the other one is developed by the Faculty of Pharmaceutical Science. For the Jula Vaccine Research Center at the Faculty of Medicine, they try to develop the mRNA vaccine, and they also have the collaboration with the University of the Pennsylvania as well to develop this kind of the vaccine to fight against the COVID-19. And right now, the test result is still in the animal test, and the result is quite good now and still go on to be planned to test in the human in the future. And they also expect that maybe the vaccine will come out maybe the third quarter of next year, hopefully. And let's take a look for the vaccine that developed by the pharmacy school. This vaccine, they use the concept to extract the protein from tobacco leaves, and they try to produce the antibodies, stimulate the cell to produce the antibodies themselves to meet the same virus. This one, they use the concept from the plant to create the vaccine, and right now still in the process to test in the human in the future, but the result from the mice and monkey show really good result. Now it's time to talk about the nation level, how they manage and handle the situation of the COVID-19. And you can see the graph that I explained at the beginning of the presentation that we got a high the new cases of COVID-19 in April and March. And after that, we try to manage and help together to fight against COVID-19. So that's why the new cases reduced and the graph is flat now. And the possible reason I summarize into the four possible reasons. But the key important reason that why we still can maintain the new cases into the low number, I think is really related to the primary healthcare in Thailand, also with the strong medical team and village health volunteer. So that's why I want to show you some of the videos that made by the WHO to show about the Thailand response to the COVID-19 situation.
So much easier to fight an epidemic like COVID-19 when you have a strong underlying health system. Thailand has spent 40 years committing itself, investing in its public health infrastructure. This is really where the rubber hits the road in a pandemic. Thailand has experienced several outbreaks of very large scale, starting from SARS back in 2003. Those taught us a lessons, make us prepare for the big pandemic. We started our implementation of WHO IHR capacity in 2006, 2007, and also improve our public health emergency management. In early March, we start to see a rapid increasing of local transmission. The number of new cases gradually reduced through April and May. This is something that WHO emphasizes to countries again and again. The need to be able to identify cases, isolate them, quarantine, and trace contacts is so important.
คิดก็ตอนแรกก็ไม่ได้คิดอะไรเท่าไหร่แต่พอรู้ว่ามันรุนแรงก็เริ่มตกใจนะคะเริ่มตกใจกันมากเลยนะคะเราทำยังไงที่จะช่วยชุมชนเราโดยเริ่มต้นจากในบ้านเราก่อน
The village health volunteers are ordinary people who devoted themselves to take care of their friends or family within their village. The strength of the village health volunteers has contributed significantly for the Thai government to keep things under control.
จะมีเชื้อโรคไหมอะไรอย่างนี้ครับผมกักตัวเสร็จแล้วผมก็โทรปรึกษาตลอดปรึกษาหมอตลอดถ้าผมก็ว่าอาการอย่างนั้นอย่างนี้ปวดเมื่อยกล้ามตัวอะไรอย่างนี้
ก่อนหน้านี้มีเพื่อนเป็นอสตที่โรงพยาบาลเขาชักชวนให้มาเป็นอสตแล้วก็อยู่ไปอยู่มาก็เขาก็ไปเยี่ยมบ้านตามเข้าไปทุกวันก็สนใจในด้านนี้ก็เพราะว่าเราก็จะได้มีความรู้แล้วก็มีสุขภาพที่ดีแล้วก็ชาวเมียนมาด้วยกันจะได้มีสุขภาพที่ดีคิดอย่างนี้ก็เลยมาเป็นอสตค่ะ
The village health volunteers and the migrant health volunteers, they are really the eyes and ears of the health system in the community. I think it's really this trust between the community and the public health system. It's doctors, it's nurses, it's village volunteers that makes this whole system run so effectively. I think one of the very good reasons that we can manage COVID-19 very well was that if you look at Thai cultures, whenever we have crisis, the Thai will unite.
So as you've seen from the video, I think the strong point is the village health volunteers and the strong medical team. And also, most importantly, all the Thai people that they collaborate and try to follow some of the suggestions from the government as well. That's also really important. But anyway, I try to summarize the key points why you can maintain the low new cases of the COVID-19 in Thailand. But anyway, it's not like we succeed everything already. We still have many challenges in the future that we need to face it in the future as well. Let's see from the first reason. I think it's about the soft policy as well. As you know that many countries also announced like the lockdown. In Thailand as well, we also have the lockdown as well. But we also do step by step as well, because sometimes when we announce and use some kind of the strong policy, it also affect some of the life of the people as well. So maybe use the soft policy and takes time to have the clear communication or the reason. Maybe it will be good for the people to understand that why you need to do this and do that, and they might prepare themselves to face the difficult time as well. I can ensure the example not on this slide, because during this kind of the situation that we have the lockdown at the beginning of the year during the COVID-19 situation, some of the restaurants, some of the people who make a living selling food, cooking and selling stuff, they also got the problem as well a lot. And the shopping malls is closed. They cannot sell, cannot make money at all. One of the owner of the restaurant, I saw that they also uh, kind of the prepare themselves, switch from the restaurant into the delivery, and also need to support their employee as well. Maybe need to talk to the employees to cut off some of the salary and work together. And if the situation is getting better, they will pay the salary with the full amount of money. So I think there is so many dimensions inside as well when we implement the policy or any announcements. So we need to think about the impact into the different stakeholder is very important. And right now in Thailand, after we announced like the state of emergency, during this time in October, we also announced that we also welcome some part of the tourists as well, but they also have the discussion about this as well because most of the new cases of the COVID-19 also came from other countries. So that's why the government also need to discuss with the Ministry of Public Health Disease Control Unit, try to come up with the strategies not to have like the second wave of the COVID-19 in Thailand. This is one challenge that I think everybody is still working on for this. And the second reason to fight against COVID-19 in Thailand that we succeed is a village health volunteers and a strong medical team. Most other people say that the village health volunteer is the foundation of the primary health care and is help for the sustainability as well. I think it's really important because the village health volunteer, I can say, is also the front lines of the medical team as well to go into the community and screen out for the COVID-19 cases. Video that you watch from the WHO that if we can identify the new cases immediately, we can contain the spread of the virus as well. So that's why the village health volunteer is really important. And the village health volunteer in Thailand is not just pop up or happen in 2 or 3 years or only 10 years, and it happened long time ago. We launched the project of the village health volunteers in the 1977, and now we have the public health volunteers more than 1.4 million all across the countries. And the village health volunteers, they are also like a local people. And you can see that from the selection of the village health volunteers, we also recruit them based on their also their goodwill, their kindness, their knowledge as well. And most importantly, if they are from the local people or the local community, it will be good because they will have the strong relationship. And then when they go to the village, they can have a good connection, and most of the people will listen to them. And during the COVID-19, the health volunteers also work with the Thai government and follow the policy as well. And relate health volunteer, they also have the information and understand the guideline from the government, and they also transfer this kind of knowledge into the people in the community as well. And they also use the strategies door to door to screen out for the new cases of the COVID-19, especially for the sensitive group, for the young children and also the elderly. That's why the village health volunteers are really important. And they also work with the medical team as well in the hospital. If they find out the new cases of the COVID-19, they also contact back to the hospital and transfer those patients to the hospital as well. The integration of the technology in the healthcare system. As you know that village volunteer also need to work and also receive the information from the government and also from the medical teams. So that's why we have the call also more online the application to transfer all the information, receive the news and message, and also can report the information from the village health volunteer back to the hospital as well. This is the picture of the application also more, and village health volunteer use this one to record the data from the suspected cases and then report back into the hospital. And if they found some of the new cases, they also can transfer and give the information to this application as well. This application got the support from the Department of the Disease Control and also the Ministry of the Public Health. So we have the application for the village health volunteer, and we also have the application that to use in the public as well to screen for and track down for the COVID-19 cases. We call the Thai Chana application. So every time you go outside, go to the shopping mall, go to the buildings, wherever you go, you need to screen your QR code and send out the information, the place that you check in and check out as well. This will help the government a lot and Ministry of Public Health to track down of the new cases of the COVID-19. Because sometimes the situation might happen like a new COVID-19 patient. Maybe they also contact or expose some of their friends and family outside. This application also can track down as well from this information. And this application also supported by the Center for the COVID-19 Situation Administration, CCSA. And they also have the English version right now. The last reason that why Thailand succeed to maintain the new cases of COVID-19 into the low number, they use the fact-based communication and centralize the structure. as I say in the beginning of the presentation that when we found out the first case of the COVID-19, we launched the Emergency Operations Center. But later on, we also launched the Center for the COVID-19 Situation Administration as well, because at that time, we lacked of the coordination among the units in the organization. So that's why the best way that we have the one center to control everything and communicate everything to all the units to manage the COVID-19 situation. So in this centralized structure, CCSA is led by the Prime Minister and also used to manage if they have the emergency or the COVID-19 situation. We can listen to the command from this CCSA. And at the same time, during the COVID-19, we got so many information and the fake news on the social media, and it caused some of the misunderstanding a lot among people as well. So that's why the CCSA, they also appointed the representative to speak on behalf of the government and provide the information. And this person also have the medical background, also provide the easy understanding to the public and create the awareness. And the most important thing, they also report the situation every day. And I think all the Thai people also listen to the the news from the CCSA on the television, or maybe from the the website, and they also trust this sort of the information from the government as well. So that's why the fake news or the misunderstanding decreased during this time. So I think all of the information or the strategy that Thailand use will give the ideas and also apply into different country, but also from need to be concerned about different context and situation among different country as well. And Thailand also have many challenge right now that we need to manage. As you see in the news about the new policy to allow all the foreigners to come to Thailand, and also some of the sensitive issue about the political situation that happen right now. So there are so many things in Thailand that we need to face and also need to get through all of this. So thank you so much for your attention, and I hope that all the information, not just only, I mean, the fighting against COVID-19, not just only the responsibilities for the government only, I think it's for everyone.
Okay.
So I think there's a time for the question.
Questions. Yeah. Before we go to the question session, we already have Bu Santi here.
Hi, Dr. Santi.
Hello, Bu Santi, are you there?
Yeah. Hello.
Hello.
Yeah. Hello, Dr. Pramon. Thank you very much for providing your time with us. Although Saturday is holiday, I think in Thailand. Yeah. but you still have time to share with us. Yeah. Thank you very much, Dr. Pramon. It's very great to have you today. Yeah.
Thank you to you as well. Maybe I will have some time if some of the students would like to ask me uh, any question.
Yeah.
Yeah,
Yeah.
there is.
Yeah.
Yeah. There is some
Okay.
question at the chat box. Maybe
Bu
the student you can speak. You can speak and open your mic.
Bu Nuzul, maybe
Yeah,
uh, the screen stop, the share screen.
the
Bu
share
Nuzul.
screen is
Yeah.
okay.
To stop first. Yeah.
Yeah. Okay, we have
Yeah.
who first? Maybe please open your mic and you can say your question directly to Dr. Praman.
Mohon izin Bu, saya ingin bertanya.
Ya,
Baik, terima kasih atas kesempatannya. Selamat pagi kepada Bu Santi Martini. Good morning, Dr. Praman. My name is Raffi Abimukti. I want to ask you about how does the Thai government regulate its citizens to follow the government lockdown regulation, and how does the Thai government make its citizens aware of the importance of implementing health protocols, especially the village community? It's clear, Dr. Praman?
So your question is about how the Thai citizen follow the policy from the Thai government through the village health volunteers. Is that
Yeah.
actually infrastructure and the healthcare infrastructure in Thailand for the village health volunteer really strong because we launched this kind of the concept since the 1977, and most of the village health volunteer really from the local community. Though they speak like I can say that they speak like the same language together, uh, and also it also gain the trust as well. So when the government implement like some kind of the policy and maybe give the information and train the village health volunteer, and at the same time provide the equipment like the device to check the temperature, the application or the support for the village health volunteer, so the village health volunteer also can uh, communicate and transfer the knowledge, use the door-to-door strategy to screen out for the new cases of the COVID-19 and give out the information that all the people you need to follow some of the guidelines to prevent the COVID-19. Why we need to do this? Because COVID-19 can cause some of the serious illness. We try to explain, transfer all of this knowledge to the people and in the community. So that's why I think the important thing is the trust between the people and the village health volunteer. And also the most important thing is about the practice like a hand hygiene and also wearing the mask and also keep the social distancing. I think all of these really important. But before they practice, they need to understand why they need to do. And the people who explain to them is the village health volunteer and also some of the medical teams as well in the maybe the local hospital or promoting hospital.
Okay, thank you, Dr. Praman.
yeah. Maybe I want to have a follow-up question related to that. So, who have responsibility to help promotion to the village?
The the organization who taking care of the village health volunteer, right? Actually, I can say that the Ministry of Public Health is the main,
Okay.
main organization to kind of have the strategy and also collaborate. And also the Department of the Disease Control as well. That also contact to the village health volunteer. That's why they also can collect all of the new cases or the information when the village health volunteer go into the communities and collect the information. And you see that the government also support the information to the application or the technology, right? That we call like a also more online to contact to the village health volunteer and also the medical team as well.
Okay. Okay, thank you. Next question from Aina. Aina, you can speak. Please open your microphone and your video maybe.
Baik. Morning, everyone. Good morning, Dr. Santi. Good morning, Dr. Praman. Thank you for an amazing presentation. My name is Aina from class IKMD, and may I ask you a question? I saw in the news that currently there are some protests going on in Thailand, which gathered some people in the same place without social distancing. And I saw the news that people even don't wear any mask. My question is, do you predict the number of COVID will be rising again or not? And I seriously hope that everyone in Thailand stays safe and healthy. Thank you.
Thank you. That's a good question. Actually, I thought about it last night that there will be some question about the protest as well. But this kind of the sensitive issue about the political conflict right now. But in terms of the public health, yeah, it's very risky to get like a COVID-19 infection during this time. The reason I have, I think many reasons as well, they didn't wear the mask because after we managed and handle the COVID-19 situation since the March and April, and the number is dropped a lot. And we also kind of not lock down the country and also open the restaurant, open the shopping mall, and no more curfew. So I think everyone feel relaxed and also they seem to not concerned about this during this time, and also have like the political conflict. So that's why the situation about the hand hygiene, wearing the mask, they forgot about this. Only some, I can say only some, but I still hope that the situation will be better, and also I believe that most of the Thai people, they really believe in the medical teams and also the healthcare team. So I think they will follow and remind themselves not to do, not need to wear the mask, and also keep something about the COVID-19 concern as well.
Thank you for the answer, Dr. Praman. Thank you. And I hope Thailand will be safe soon. Thank you.
Thank you.
Okay. Thank you, Aina.
But,
okay.
Yeah.
I can say actually, we also afraid that we might have the second wave of the COVID-19 in Thailand as well. But let's see that. I think we will work on together and fight together during this time. I think the medical teams and some of the people in the MOPH and the Department of the Disease Control, I think they still work hard and also concerned about this situation as well.
Thank you, doctor, for the answer.
Yeah. Okay, thank you. Okay, for the next question, Amira.
Yes.
For a moment, because Busanti will be left soon. Would we have a photograph session first?
Sure.
Okay, that's great. So please, all of the students, you can switch on your camera and we will have a picture first.
Sorry, Bu Nuzul.
That's
Sorry,
all right.
Dr. Pramon, because today I have five activities in the same time. So I have to attend in each meeting. Yeah. Sorry.
Don't worry. I also thankful to you as well that you are inviting me today to speak about the COVID-19 situation, and hope that we can work together in the future to solve the problems of this.
Yeah. Thank you very
Okay.
much, Dr. Pramon. Yeah, I hope we can develop more activities after this. Not
Yes.
only stop in this activity, but I hope we can have many joint activities in the future. Yeah. In the,
Okay,
in the short
everyone.
future, not in the long future. Yeah.
Okay, everyone. So let's share your best smile. 1, 2, 3. We have 9 times takes pictures for this. First, smile. Okay, next screen. Smile. Even though there is no sound like a camera here, but please believe me that I take your picture all. Okay, so many people here. Wait a minute.
Yeah. Thank you very much also for the student, yeah, for joining this guest lecture.
Okay, got it. Thank you everyone for having a picture together with us. Okay, let's continue to our next question from, let's see, from Amira Salma. Okay, Amira, you can share your camera and turn on your camera. Ya, ya, ya.
Izin ya.
Iya, iya Bu, terima kasih.
Bisa ya? Assalamualaikum warahmatullahi wabarakatuh.
Okay, Amira, you can.
Yes.
Yeah.
Yes, I'm sorry, I have trouble with my camera. Hello, good morning,
okay.
Mr. Pramon, and hello, everyone. My name is Amira Salma from class IKMB.
Yang saya hormati,
Whether by using lawn care application can guarantee the clean lines of their community after using their smartphone. How to monitor it? Thank you, Mr. Pramon.
That's a good question as well. Actually, this one, I mean, a lung care application, not to diagnose for the COVID-19, but the way they use, they need to clean after they use as well with the alcohol, use a lot of the cleaning gel as well. Otherwise, it will maybe contact with some other infection as well. That's a good point as well. But this lung application still not used all across the country, yes, but just used for some limited number of the people. I can say like that. But a good point, but we need to clean as well.
Okay, thank you, Dr. Pramon.
Yes. Actually, I would like to ask some of the maybe share ideas, not ask a question, because I'm not sure that when we switch into the online classroom, uh, everyone is okay. And, as I say at the beginning, because when we switch from the regular classroom, we know that some students they also have the financial difficulty as well. It happened to my university as well because some of the students, the family, the parents got laid off. That some of the business collapse or something. That's why they have the financial difficulties. So that's why, as a university, we also concerned about this. So, is that the same situation at the
Yeah.
University of Malta as well? That you need to switch to the online, and some of the students they cannot access to the internet. And how to
Okay,
say?
maybe some student can share their thought about this before I can tell something policy from our university related to this online online classroom.
Mhm.
Okay, some student, can you share your experience about the financial hardship during this online class? No one. Maybe they are too shy to say about that. Yeah. Maybe I can share my experience related to this. Recently, we did a research to not research, some like mini survey to the fifth semester student, and we asked them about how hard this online class for them, and some of them say that the most challenging things is understanding about the instruction of online class, and some of students say that there is a financial hardship, such as like some students say to me that his father are fired due to the COVID, and then some student in the village on the remote area of Indonesia, so find internet connection because there is no connection at their home, and gratefully that our ministry and also our university support the student by share like data packets or internet free to the student, and I hope that it will help our student to be able to have a qualified learning process. And how about in Thailand, is also something like a policy like that?
Same as well, that we also provide like a SIM card for them to
Mm,
access to the internet, and also we also lend the laptop or the notebook for the student who are qualified for this as well. Because some
mm,
of the student they didn't have enough money to buy the notebook.
yeah,
And I think I saw some of the question about the
yeah,
college PCR test. Right? Uh-huh.
yeah. Okay. Dewi Verdanis, you can say your question. Please open your mic.
From Devi, you asked
Yeah, Dewi.
how about the college of the PCR test and how the government handles the social impact of the crisis. Social impact of the crisis. PCR test, yeah, this is a good question. Even though I myself, I can say that I don't have much information about it, but PCR is quite expensive as well. It's only some cases that
Coba
uh,
Kak Bu.
support for the PCR test. Hello? Yep. Hello, hello.
Yeah, go on, go on.
Okay.
Yes, doctor.
Yeah, only some cases that the government support the PCR test, but this one maybe I will find out more information about the college for the PCR test. But from what I know, it's still expensive, and not everyone can like get the free PCR test support by the government. Need to be like a uh, I will check about that again and give the answer to this later on. But what about how the government handle the social impact of the crisis? Handle the social impact of the crisis. I think about the trust and fact-based communication, like I say. Sometimes if the situation is not good, maybe the government needs to tell the truth and ask for the cooperation from the people. I think that is the best way rather than like hiding something or hiding some information from the people. So people will be aware of this and then they will follow what the government say to them. I think that's the most important things.
Okay.
Thank you, Dr. Pramon.
And also, may I say that I think Thai people also really trust in their medical team and medical people. I don't know what they say is right or not. So that's why every time there's an announcement from the Ministry of Public Health or the representative, they also follow the policy and the guideline from them because they see that really hard during the COVID-19 situation. Some of them couldn't go back home, spend time with their family. Doctors need to stay in the hospital. Nurses as well need to stay in the hospital all the time. So I think Thai people really know about this. So that's why they work together, not to put all of the responsibility to only one side. So that's my opinion as well, including wearing the mask. but during kind of the protest, it's hard to say. Like I say. Any question?
Yeah,
How
there are more
universal
questions
innovation?
from
What
Amalia.
kind of yeah. Amalia, how university support the innovation? What kind of initiation university did? Was there any grant from the university? Yeah, of course. We have the like grants a lot in the Chulalongkorn University, uh, and also the support for the research study and innovation. And as you know that most of the university, they really concerned about the SDG. They try to set the goal to have the innovation and research study according to the goals in the sustainable development goal. So that's why they also have the grant to support, uh, and they need to check that the innovation or research study that you create can implement and practical to use as well. As you can see that the robot we developed is developed by the faculty of engineering. They also test and also use in the Chulalongkorn Hospital, and also they can check that if any hospital in Thailand also request for the robot, they also send out to those hospital as well. So the main important things is time from the innovation and research study to the real things that practical and can use it. And the question from Rana, I want to ask about the project of the health volunteers in Thailand. You said that the health volunteer launched in 1977 is long ago. What is the background that Thailand did the health volunteer project in 1977? Let me see. The project at that time, from what I know, I think it came from the concept idea from the health for all. It means that everybody should have like a good health, right? And they also create, and also they think that there might should be someone to get into the community and promote the health for the people. So that's why they also use this kind of the concept of the health for all and set up of the health volunteers. But at that time, I think the group of the health volunteers is still really small. And they also need to think about the infrastructure during that time, about the healthcare coverage, that you might hear something about universal health coverage in Thailand. They also think about the big picture, the structure of the universal health coverage as well. But the village health volunteers occur before that. I have a quick question from Elizabeth. To ask, are there people in Thailand who still don't believe in COVID-19? And also, are there any penalty sanction in Thailand for those people who don't comply with the health protocols or policy? If there is what kind of sanction? That's a good question as well. Maybe to give the clear picture, right now in the shopping mall, they also ask people to wear the mask inside. If you not wear the mask, maybe you cannot go inside the shopping mall or go shopping. This one of the example as well. But we're not gonna go like arrest them and put them into the jail. But I think maybe all the people will look at those person and also maybe the penalty from the society, in my opinion. But for the case that some of the people will not quarantine after coming back to the coming from other countries and come back to Thailand and not follow the policy like state quarantine, maybe this kind of situation, we need to use the law enforcement as well. And maybe some of the officers need to talk first that we can, if you follow the news, there is also some of the situation occur as well, that some of the for foreigners didn't follow the rule or the regulation of the state quarantine.
May I ask something? Because it's related to this question. Maybe in Indonesia, some people, not some people, a lot of people think that COVID-19 is a conspiration. Some people think that it's kind like of the way of health workers in Indonesia to raise up their money, something like that. It's also happen in Thailand?
You mean that some misconception about
Conspiration.
constitution? Sorry, can you give more examples?
Yeah, some people say that COVID-19 is not exist. It's kind of disease that created by health worker to make them more money, something like that.
Okay, I see. I think it's happened in some part of Thailand as well about the wrong belief about this. But the most important thing, like I say, that how you can build the trust. Because if you trust someone, tell someone about the story or the something, they will believe in you. Right? So I think the most important thing is to gain the trust. But who will talk and make them feel trust to those people? Maybe the local people or local community, like for example, like a village here that I say that that's why we recruit some of the village help volunteer from the local people because they speak the same language. In Thailand, we have the 4 or 5 regions of Thailand, so they also speak the different languages as well. So it might be good to have like village help volunteer from the local people to talk it out and explain and also to gain the trust of them. Even though the government and the people to gain the trust from the people, the government need to tell the truth and show the sincerity to the people as well. Mhm. Otherwise, the people will not follow the policy or follow the direction from the government.
Okay, Elizabeth, do you want to say something?
No, thank you very much for the answer, Mr. Rahman. Very insightful.
Okay, I think there is someone raising his hand. Please pick up Mr. Ulul Arham.
Okay, thank you so much, Miss Ulul. Sorry, I have terrible in my camera, and actually my question is similar with before about the policy of or the sanctions or about the people who is still ignoring the social distancing or wearing a mask. In Indonesia, there is a lot of people do not want to wear a mask when they go outside, or there's a lot of people who is still ignoring the social distancing. And yeah, like Miss Ulu said, that there is a lot of people still don't believe was COVID-19 is real. So from the answer you answered before, I feel interested, so I don't have any question more. Thank you, Miss Ulul. I'm sorry, I forgot to raise down my hand.
Okay, thank you.
Actually, it's related to the human behavior as well. To chase someone to wear the mask, or I think you know daily plan behavior, right? If you know the fact that the COVID-19 can harm your body, and some you may know information that lung damage from the COVID-19 after getting infected by the COVID-19 is irreversible, and also is also affect the loved one in your family. If you have the family who are members are really old, this some kind of the message. Not pay allow. If you can send this kind of message with the fact, evidence, I think it create the moral of the people who not aware of the COVID-19 situation. They tend to, because everyone need to do something to protect themselves as well, right? And then we also concerned about the loved one as well. Maybe some kind of a campaign or something that if you not practice or protect yourself, it's also impact to your loved one. You want to see your loved ones die because of COVID-19 or not, and you will be blamed for the rest of your life. This is just some of the example. But anyway, need to have like a trust and work together and create the awareness. It's very important. Yeah, someone also say about the culture, right? Just our
Yeah.
interaction with other people, no matter what, who they are. Interaction. The way to interaction, we need to shake hand all the times, right? Sometimes I'm not sure that in this meaning of the question, from the India, you said that Thailand can fight COVID-19 with a good medical team, so it can decrease the prevalence of disease. Indonesia had a lot of medical team. They were maybe as good as Thailand too, but the case in Indonesia is still high. It's just because of our culture to have an interaction with other people, no matter who they are. So my question is there any similar culture in Thailand to have interaction to people in this pandemic situation and how it's going? Uh, because in Thailand, our culture, we use like the hand say sawasdi and not like hugging or the shake hand. So that's why we have like a distance. But anyway, for the countries that have like an interaction, I think in this kind of situation, I think everyone aware of this. So if you don't have a shake hand, it doesn't mean that you hate that person. I think they understood that. Why don't you just show some care and love, asking like, how are you, how your life so far, and show the caring feeling. I think it might be better than shake hand or something as well. But I know that it's hard to change the culture, but if you have the mindset to protect yourself and the one you love, I think it's not hard to do that. And another question about Lina, what is the most impactful activity of citizens in Thailand that make prevalence of COVID-19 decrease fastly? That's all. The most impact activities. I think wearing the mask. No? Activities. Let me see. Activities. So I'm still thinking activities, but I think before everyone wearing the mask, like I say, but it's not the activities. Nah. They know that the medical team, healthcare workers work really hard and they try to support uh, giving applause to them, some kind of activities, and follow the healthcare workers' suggestion and recommendation. And that's why you can see that a lot of people wearing the mask, and also the healthcare workers also say thank you to all Thai people to follow this and help together reduce the COVID-19 cases. It's like to show the compassionate. Maybe I can think of this kind of the activities that they share the love and care to each other. So that's why the case of the COVID-19 is decreased because of we follow the campaign, right? Wearing the mask, a suggestion from the healthcare workers, wearing the mask, have the hand hygiene, have the social distancing. But as you know that nothing in the world is perfect. So you wearing the mask, hand hygiene, sometimes you forgot, but you need to remind yourself as well. But it's still good that at least you still wearing the mask.
Well, can I ask something because I wonder about these things. Okay. Actually, I'm learning currently I'm learning about help for the marginalized people during COVID-19. So how about how the governments uh, do or they help marginalized people in Thailand during this COVID-19? For instance, like the sexual worker or something, people who informal worker or like that. Is there any government policy related to that?
Mm, they have the policy at the beginnings of the lockdown period. Also give out some of the money as well. As far as I remember, to help some of the poor people and some of the unemployment people. And at the same time, I think not just only the government, uh, also all the Thai people as well. That's what I say about the policy of the government to give out like the money, right? And also some of the maybe the events that have the campaigns of not the campaign, the discount of the goods for all of the poor people. And also the most important thing is about Thai people. So what I'm trying to say that there is some activities that some of the Thai people who survive or have enough money, they put some kind of the cabinets outside their house and also put some water, put some food, and also put some of the something for eat or anything, and also put like a notice that this is the uh, I translate into Thai like a happiness or sharing cabinet, and you also can get the food or the drink for free, but take out some amount that enough for you to survive. So you can see some of these in front of the house all across the country as well. Just try to help each other, not just only for the government. I think all of the Thai people and individuals need to share the love and care for each other during this time. And also
Okay, thank you.
as well, they need to adjust. Yeah. Like I said,
Yes, as you are pointing.
to adjust everything.
I see. Thank you so much for the answers. Okay, is there any question from the student? I think, uh, okay, no one. So I think, yeah, thank you, Elizabeth. Thank you for everyone. Thank you for Dr. Praman. I think that our student already asked all of their question. Thank you for sharing talent experience with us.
So I'd like to say thank you to all of you as well, Dr. Santi, University of Alanka, to give me an opportunity to uh, present today about the COVID-19. So the COVID-19 is not just the responsible for the government or only one nation. It's all across the world. Every nation need to work together. So I hope you stay safe and also we get through the tough time. It's like a journey. Don't give up on hope and be strong and be happy.
Yeah.
See.
Okay.
So thank you so much. Bye bye. Or you want to say something?
Okay. Our student is someone want to say for this closing session. Please raise your hand or open your mic. I see that you can talk everything or share your share your impression for this today lecture? Maybe.
May I, Miss Ulu?
Yeah, sure. Thank you. Too.
First, I want to greet Mr. Parmon with Thailand. Sawadee krap, Mr. Parmon.
He's learning.
I usually watch a Thailand movie, so I can understand a little language from Thailand. So when I try to learn Thailand, is I think it's very difficult language. So it's different when I learn English or Arabic or maybe Spanish. But I feel Thailand language is very difficult, sir. Is that true? And do you have a tips to me how to learn language of Thailand carefully? I'm sorry, out of context, Miss Ulu.
Different like uh, um, what can I say? Like when I learn English, I think use your heart is the most important thing, and don't be afraid to make the mistakes. Is really important. The more you practice, the better that you will get. I think it's the most important things. Sometimes, even though you cannot think of the sentence or the word, you can communicate by your heart. Use your hand, try to communicate. I think people will understand you as well. That's the most important.
Okay. Thank you so much for the tips. That's important tips for us who want to go to Thailand. Okay. Thank you so much for your presence and your sharing, Dr. Pramon. I hope we will still can collaborate in the future, in the next future, in short future, not long, because we really want to still have a good relationship with you and your collaboration with us. Thank you so much. And I will say to Dr. Santi for your greeting to her.
Okay. Thank you. Terima kasih.
Thank you. Yeah, thank you.